Hello, class. My name is Mario Lopez. This is my reflection in action journal. So, what, some of the questions that there are prompts to is synthesize and identify the key components of the course for you. So, I believe that the key components of this class is first is the organization structure, which I believe was pretty good. It kind of fulfill my expectative my what I thought before because they cover the first weeks. They cover the OBGYN and pediatrics, which we hadn't had a lot of discussion about those topics, but in this class we did, so that I was very happy with that. In After that, then the system kind of structure or approach that the program has, as respiratory, cardiovascular, and all that. So it's very good to refresh your memories of topics that we already discussed, and now in the acute care kind of perspective. Now I believe that also the assignments were very good. The standards procedure assignments, that was very good. Because it gives us an idea of what we're going to be looking at once we start practicing, and once we see those standardized procedures that we're going to have to work with once we become nurse practitioners and have to deal with all those protocols or the stuff that we have. The other thing is the medu cases. Of course, they were great. Like always, they give us an opportunity to keep up with our interviewing skills, or is in a clinical kind of setting, but the ability of doing it in our home. But that's easier because we have the ability to look up more stuff and learn. It's a very good learning experiences. So discuss how this will be implemented into your new role as an advanced practice nurse. Well, I believe that the foundation of my advanced practice registered nurse role, it happens now. Everything, all the lessons that I've learned before, all the lessons that I will learn until the day of the graduation, that'll be my foundation of what I will become in the future as an advanced practice registered nurse. And that's all the mistakes, all the lessons learned, and that will make me grow as a professional and as a clinician. I think those are key. The clinical rotations are key to give us an opportunity to experience firsthand what are some difficulties that you have in today's clinical practice. Identify challenges I have encountered with a class or course content. Well, some of the challenges, like always, like wrote in my evaluation, is the same thing. When you are a professional already, a registered nurse working 12-hour shifts, some people with my situation with family, trying to go through grad school, and at the same time having time to do clinicals, working full time. It's just challenging overall to keep up with the reading, learn all these new skills, and be able to excel in all of those. So all those are of course challenging and hard, but I am just happy that we're at the end, almost finishing everything. So I'm very excited of what's coming. So that's as far as the class content, just time management is always tough because life goes on. So there's a lot of live events that we're missing, but overall it was very good. Great learning experiences throughout all my clinical sites and all my clinical rotations, which I did OBGYN in this class. So it was great. Identify positive or negative thoughts, feelings, or emotions that I've encountered as a result of any knowledge and practice change that I have experienced at the end of this class. So of course the clinical rotations are my favorite part in all the classes that I do, because I'm a nurse, right? We're registered nurses and we love patient contact. We love being there for the patients, teaching to the patients. The key things that I've learned and that I have seen is health promotion, disease prevention, key factors. That's where healthcare is going. That's what we're going to be looking at. So I really enjoyed positive feelings about the ability of teaching the patients how to eat better, how to take care of the blood pressure, diabetes, and all those issues that they run in, all those obstacles that they have to overcome. It was just great. So the ability to provide just patient care in general, I think that those are the positive feelings that I'm having. Thank you very much. That was my reflection in action journal.